morning, everyone. I am Mary Louise San Diego from Group HAvengers. I am here to present our group study on Republic Act No. 11223, or the Universal Healthcare Law. Republic Act No. 11223, known as the Universal Healthcare Act, is the new law that seeks to provide universal healthcare in the country by way of clear delineation of roles of various agencies and stakeholders towards the development of our national healthcare system. Universal healthcare is described by the World Health Organization as a situation where citizens can access health services without incurring financial hardship. In accordance to this, the Universal Healthcare Act also aims to ensure that all Filipinos will be granted access to quality and affordable healthcare goods and services, notwithstanding differences in cultures, values, and beliefs. That's why in population coverage, this law automatically enrolls all Filipino citizens to the National Health Insurance. For operative accomplishment, these objectives are to be guided by a healthcare model that enables Filipinos to access cost-effective, promotive, preventive, curative, rehabilitative, and palliative health services without the financial burden. As per the service coverage, medical, dental, mental, and emergency health services are to be delivered with a conditional, fair, and transparent health technology assessment process. Membership on this program is classified into two types. Direct contributors are those who pay PhilHealth premiums, or those who are employed and bound by an employer-employee relationship, self-earning, professional practitioners, and migrant workers. The second type is indirect contributors, composed of those who are not considered as direct contributors along with their dependents and whose health premiums are subsidized by the government. Financial coverage states that population-based health services shall be financed by the national government through the Department of Health and shall be provided free of charge at point of service for all Filipinos. DOH Secretary Francisco Duque cited other funding sources for the Universal Healthcare Program, including PhilHealth subsidies to the indigent families, PhilHealth Gaming and Amusement Corporation, and Philippine Charity Sweepstakes Office, the Philippine Constitution, because it supports the right to health of all Filipinos. According to the Philippine Constitution, under Article 13, Section 11, the state shall adopt an integrated and comprehensive approach to health development which shall endeavor to make essential goods, health, and other social services available to all the people at affordable cost. Every Filipino has the right to the highest attainable standard of physical and mental health, which includes access to all medical services. With the implementation of this law, the state will do its responsibility to provide low-cost health services to its people, and the right to health of all Filipinos will be exercised. According to Chapter 3, Section 1, more budget is allotted to PhilHealth. Based on the official report of the Department of Budget and Management, PhilHealth had 54.1 billion budget in 2018. With the UHC, it aims to increase the budget of PhilHealth to 67.4 billion, 24.4% higher than last year. And since the PhilHealth will be in charge of paying healthcare providers like hospitals and clinics for services given to Filipinos, more budget to it means more people would be catered. According to Chapter 1, Section 3B, there will be an equal access to healthcare. The main advantage of this type of healthcare is that it gives people that can't afford healthcare the services they need. The system provides basic services for all citizens, and it doesn't discriminate against anyone. It helps those that aren't employed or have other difficulties getting healthcare when they need it the most. According to Chapter 2, Section 5, there will be an automatic health insurance for all Filipinos. Under the Universal Healthcare Act, all Filipino citizens will be automatically enrolled in PhilHealth and therefore will enjoy access to primary health services. Some people are not aware of the processes one need to make to avail health insurance such as PhilHealth. Another good thing about this law is that as long as you're identified as a Filipino citizen, you can avail healthcare benefits even without PhilHealth ID card or other paper requirements. According to Chapter 3, Section 2, there will be an expanded PhilHealth coverage. The Universal Healthcare Act will add preventive healthcare services to existing PhilHealth benefits such as free consultation fees, laboratory tests, and other diagnostic procedures. Department of Health Secretary Francisco Duque III said that the law will change the country's present healthcare system from being, quote-unquote, used to taking care of the sick to one that is used to keeping people healthy. Lastly, according to Chapter 6, there will be better healthcare access and quality in the Philippines. According to DOH data, there are 33,000 patients per doctor and 1,121 patients per hospital bed in the Philippines. Because of this, the Universal Healthcare Act will seek to provide the doctor-to-patient ratio and upgrade hospital bed capacities and equipment. To achieve these goals, the bill proposes the building of hospitals in remote places. It also requires all graduates of all health-related courses from state universities and colleges or government-funded scholarship programs to serve for 3 years in public care. Law remains constitutional. There are still few disadvantages that comes along with it. It is not completely free. As discussed, there will be two contributors, the direct and indirect contributors. The direct contributors are required to pay certain rates that equate to the amount of the contribution of these payers every month. Based on the past law starting from 2019, there will be a 2.5 contribution rate until 2025, having 5% of their salaries. At the same time, the budget will come from the added taxes of goods. Direct contributors will pay for others' health care. The monthly contributions of the direct contributors is one of the main sources of the budget of the government for this law. It basically says that the working class of the Filipinos are the payers of the health system for the people in the lower class. Since it is indicated that the indirect contributors will not pay anything for their health care and the government will subsidize for them using the contributions of the direct payers. Medical abuse leads to limited services and cost cutting. Since the people in the lower class know that they would be benefiting in this law by having free health care, people may abuse the system and seek care conditions that don't require a visit to the hospital, or they would not prioritize much more on their health because they would think that they could just go to the hospital and pay nothing at all. With this, it would be a future problem that the government should attend to if there would be a deficiency in the budget that could lead to the rationing of medical services and cost cutting. Longer waiting time for medical attention. This system is run by the government. Their main focus are the people who needs emergency health care would be the first one to attend to. So if the patient is not within their emergency case, you would not be the priority and will have to wait for a time that applies for elective procedures. There will be circumstantial poor quality health care. The pool of patients of the doctors is too much to handle in one day, and also with a low income, they might spend less time in assessing the patient correctly with their sickness and needed treatment. No competition, no innovation. Based on the law, the doctors in the accredited hospitals would have the same amount of salary, which is lower than the usual. With this, there would be a reduction of attraction of the profession in the future that may lead to shortage of doctors. At the same time, it eliminates the free market for healthcare with low prices but quality services. This Republic Act can be related to dentistry by the following. According to the World Dental Federation or FDI, oral diseases are increasingly common in low and middle income countries. Philippines is still a developing country, and therefore, oral health is not being paid attention because Filipinos think that it is just a waste of time, and they lack money as well. But with this universal healthcare law, Filipinos can already have access to some dental procedures. According to Chapter 2, Section 6 of the Universal Healthcare Law, every Filipino shall be granted eligibility and access to preventive, promotive, curative, rehabilitative, and palliative care, may it be medical, dental, mental, and emergency health services. But let us try to focus on the dental part of this eligibility of the Filipinos. Dentists perform procedures to prevent, promote, cure, and even rehabilitate a tooth or teeth. For instance, a patient has gingivitis, which is a mild periodontal disease. The dentist can perform a preventive procedure for it not to continue to a severe periodontitis. Usually, the procedure done for gingivitis is regular dental cleanings, which is a common procedure and most likely to be covered by the UHC law. Also based from Chapter 6, Section 25B, the Commission on Higher Education together with the Department of Health shall expand scholarship grants for allied and health-related undergraduate and graduate programs. The scholarship shall be based on the needed people to work for the country. Also, the scholarship shall be applicable for the bona fide residents and to those who really cannot afford to go to universities. All graduates of the allied and health-related courses who became recipients of the government-funded scholarship are required to attend in the areas that are underserved for 3 years. With this, aspiring dental practitioners who lacks money can already have a chance to become dentists and work for their underserved community. Graduates of universities under private sector, just like us in the future, are required to work in the public sector as well. Still based from Chapter 6 but Section 25D, CHED, PRC, and DOH together with the duly registered medical and allied health professionals shall reorient medical and allied health education and health professional certification and regulation in producing health workers with competencies and provision of primary care services. Dentists who wanted to pursue community dentistry fits here. DPG taught us to be strong in our conviction to love service to the youth, country, and God. Since being a dentist will become our profession and one of the ideals of the dental profession is service to the youth, we can work in the public sector to be able to educate those who are unknowledgeable regarding oral health and apply dental procedures based on what we have learned from the university. Again, we are not forced but only encouraged to work for the Filipino community. Universal healthcare law does not only benefit the Filipino citizens, we can also benefit from this as students and professionals. So we hope that people will not disregard when something in their mouth or tooth aches because universal healthcare law is already here for them.